Welcome to NapNap's microlearning segment on RSV prevention. I'm Jody Stabinsky, a pediatric nurse practitioner practicing in Pennsylvania. This brief segment will provide an overview of the current practice recommendations for RSV prevention, including indications for usage and recommended dosages. Let's begin by discussing nirsevimab, which was approved in July of 2023 under the trade name Beyfortus. It's a long-acting monoclonal antibody for passive immunization that's expected to reduce the risk of severe RSV disease by 80% among infants and children. Synagis or palivizumab is also a monoclonal antibody for RSV. The main difference between the two is that protection from nirsevimab is expected to last 5 months, providing infants and toddlers with protection for an entire RSV season, and nirsevimab has been FDA approved and ACIP recommended for a much wider population. Palivizumab lasts approximately 28 days, so infants may need multiple doses during an RSV season. So let's first talk about nirsevimab. Considerations is for all infants younger than 8 months, a dose of nirsevimab is recommended if they are born shortly before or entering their first RSV season, which typically runs from October through March. Consider giving nirsevimab if the mother did not receive the RSV vaccine during her pregnancy, the mother's RSV vaccination status is unknown, or the infant was born within 14 days of the maternal RSV vaccination. For children 8 to 19 months old who are at risk for severe RSV disease, nirsevimab is recommended for children entering their second RSV season, meeting the following criteria: children born prematurely and have chronic lung disease, children with severe immunocompromise, children with cystic fibrosis who have severe disease, American Indian or Alaskan Native children in this age group. Children 8 months old or older who are not at an increased risk for severe RSV disease should not receive nirsevimab. Keep in mind that RSV seasons can come earlier, especially in certain parts of the country, so it is best to have an ongoing conversation with families at all well visits so they know what to expect. Beyfortus is supplied in a single-dose pre-filled syringe of either 50 milligrams or 100 milligrams. Beyfortus may safely be given at the same time other immunizations are given. For the first RSV season, the dose is based on weight. For infants less than 8 months of age, 50 milligrams is recommended for infants weighing less than 5 kilograms or around 11 pounds, and 100 milligrams is recommended for infants weighing 5 kilograms or more or 11 pounds or more. For high-risk children, age 8 months through 19 months of age, eligible for nirsevimab during their second RSV season, 200 milligrams total is recommended by administering 2 pre-filled 100 milligram injections at the same visit at different injection sites. Another new RSV preventative measure is maternal vaccinations. The CDC recommends either maternal RSV vaccination or infant immunization with RSV monoclonal antibodies. A single lifetime dose of the Abrysvo vaccine is recommended to be given to pregnant mothers during weeks 32 through 36 of pregnancy, administered from September through January to pass along protection to their baby. Pregnant women that have received the maternal RSV vaccine Abrysvo more than 14 days before delivery will provide coverage for their infants, and their infants should not receive nirsevimab. It's very important for mothers to be aware of their RSV immunization status when they deliver so their newborn can properly be protected. If there is a question as to the mother's Abrysvo vaccination status, the CDC recommends that their infant receive nirsevimab. In summary, nirsevimab has been approved for the prevention of RSV lower respiratory tract disease in infants during or entering their first RSV season, in children up to 19 months of age who remain vulnerable to severe RSV disease through their second RSV season. Mothers that have received the maternal vaccine and deliver after 14 days have protection for their infants and the infants should not receive nirsevimab.
I thank you very much.